I think once you get to that point where you're feeling good, then nothing tastes as good as feeling good feels, and you really start making choices based on that feeling good feeling. My name's Amy Medling. I am a certified health coach and I'm the founder of PCOS Diva. PCOS is an acronym and it stands for Polycystic Ovarian Syndrome. It's the leading cause of female infertility, and it's an endocrine disorder that affects upwards of 10% of women worldwide. I first realized that there wasn't things weren't quite right when I was about 14, and my cycles were very erratic, and I started experiencing some of the symptoms of PCOS, hair loss and hair growth, and for a 15-year-old girl, it's kind of horrifying. And my mom, of course, took me to the doctor, and like many young girls with PCOS, I was given the prescription for the pill, and took that pretty much throughout my teenage years and into my 20s. And then it was really when I was a freshman in college, and that I really was trying to find some answers. And the doctor, I remember this really cold exam room, and laying there very vulnerable, and the doctor really didn't name what was going on, but just basically said to me, we're gonna have to jump through hoops one day to get you pregnant. So for a 17, 18-year-old girl, that's really not what you want to hear. I never really accepted it as my truth. I think it's really difficult for doctors to diagnose PCOS because most doctors are treating the specific symptoms. So, you might have acne due to elevated androgens, and you've gone to your dermatologist, or the dermatologist is treating you for hair loss or the hair growth, or you're at the psychologist because you're depressed or have anxiety. There needs to be a greater awareness within the medical community, and that's something that I'm attempting to do with PCOS through patient advocacy. Women come to PCOSDiva.com to learn more about this syndrome, and we have hundreds of articles about different aspects of PCOS with lots of research to back them up, so that my hope is that women will go to her doctor with the research and the knowledge to help advocate and get the diagnosis that she needs. We finally had this beautiful baby boy that we were, just dreaming of. And it was after that pregnancy that I just did not bounce back. And I had this little baby and a toddler, and my husband came home just, with the house in disarray, and a wife that just really couldn't cope. It was really kind of my rock bottom. Really, the first thing that I did was I found a naturopath. And that really opened my eyes to the possibility of using diet and lifestyle to manage my PCOS and to help me feel better. One of the very first things I did was I bought a glucometer, and I used the glucometer to really start understanding how food was making me feel. That little bit of knowledge was really all I needed to make empowered choices around the food that I ate. I kind of figured out what worked for me, and that was lots of plant-based foods, so lots of vegetables and low glycemic fruits. I found that more of those tropical fruits like pineapple and mango, I could only take in small doses or they would affect my blood sugar. I remember bringing in the research data to my doctor and saying, look, did you ever hear about this? And she saw my lab results improve over the course of this year and this journey, that I kind of took with changing my diet. She started becoming a believer. She started actually referring her patients to me that couldn't tolerate metformin or the pill that had PCOS. And so I started talking to these women, and they started seeing results as well. So I ended up getting a certification as a health coach and started seeing clients, and I've counseled over 100 women over the course of my one-on-one coaching. And I think it was really through coaching women one-on-one and really seeing common denominators and what worked for women and what didn't work for women that I was really able to establish kind of a protocol. When I started realizing that I was really touching people's lives and they were improving their lives based on what I was writing about and my experience, and that I could really shortcut sort of the path for them, that was thrilling. I mean, there's nothing like being able to help somebody overcome their PCOS and thrive. As I mentioned, PCOS can have a genetic component, and my sister has it, my mother has it. There's a real possibility that my little girl may have PCOS, and I want her to know that it's not this negative thing that I once thought it was. Gosh, I'm getting emotional. But it's this opportunity to be able to live life like a diva.